Hello, this is Dr. Maya Bachour over at Loudoun Smile Center, and I'm here today to answer some of the common questions that we get about sleep apnea and oral appliances. As a diplomate with the American Board of Dental Sleep Medicine, helping patients diagnose their breathing disorders and getting it treated and improving their lives is a very important part of my practice. Sleep apnea is when you stop breathing at night. A lot of patients are not even aware that they stop breathing. So when your breathing stop multiple times or it become really shallow multiple times during your sleep, that prevent the oxygen from reaching your brain, and your body end up waking up. Even if you're not fully awake, your body is waking up and trying to restart the breathing process every time. Sleep apnea can affect any age. Even kids could have sleep apnea. Some of the most common risk factors are snoring, larger neck size, perimenopausal and postmenopausal women. If you wake up tired and not refreshed in the morning, even after sleeping 6 hours or so. And also if you have a family history with sleep apnea, these are high risk factors. However, a lot of people with sleep apnea do not meet the stereotype, so we shouldn't just be looking at how things look. We should always go by symptoms. Sleep apnea can affect oral health in many ways. When you breathe through your mouth is dry. So you would have higher incidence of tooth decay and of gum disease. Also inflammation, ulcers, all can be found in the mouth. Actually, the dentist can be one of the first healthcare provider that can discover signs of sleep apnea when we look in the mouth, because we usually examine the airway, the jaw symmetry, the position of the teeth. If somebody has smaller jaw, crowded teeth, larger tongue, position of the tongue, it all affects the airway. The dentist help see the very early signs of sleep apnea and discover if the patient could possibly have sleep apnea, because the dentist, during a regular exam, we check the airway, we check the jaw position, we check also the teeth position. So if you have smaller jaw, you have crowding, you snore at night, this is one of the signs of sleep apnea. The dentist after that will refer you to your physician to get a sleep test, and if you get diagnosed with a sleep apnea, the dentist will work closely with your physician to treat the condition. Sleep apnea has several treatment options. CPAP is definitely one of the options. Another option that the dentist recommend is a custom-made mandibular advancement device. It's basically a double night guard, one go on the top, one go on the bottom. They gently move your lower jaw to a favorable position to open up your airway. We don't look for surgeries as a first line of treatment. Sometimes surgery is recommended, but we try a lot more conservative options like CPAP and oral appliances, and we most of the time get great results with this treatment before even going to surgeries. For some patients, depends on their case and depends on the obstruction in the airway, surgery is needed for treatment. The appliances the dentists recommend for sleep apnea are mandibular advancement devices. These are custom-made appliances. It made to fit exactly your own mouth, your own teeth, and your own TMJ, which is the joint up here. It gently moves your jaw forward to the most favorable position to open up your airway. Again, they're very custom made, and the measurement for the device and the type of device you get, it's very specific to you. If you feel like you've been told that you're snoring, you wake up tired in the morning, and you want to know if you are possibly having a sleep apnea, you can just give us a call at Loudoun Smile Center, 703-297-4407. We would love to look at everything for you and help you to determine if you should be getting a sleep study or not. I hope I've been able to answer some of your questions regarding sleep apnea. But if you do feel that you're at risk of sleep apnea, or you just want to find out if you could be at risk of sleep apnea, I'll be happy to talk to you. Please give us a call at 703-297-4407. We treat sleep apnea, and it's a very important part of our practice here at Loudoun Smile Center.